So now we'll discuss about cranial nerve 3, 4 and 6. So cranial nerve number 3, 4 and 6. The third cranial nerve is the oculomotor nerve. The fourth one is the trochlear nerve, and the sixth one is abducens nerve. So the fifth nerve is actually the trigeminal nerve, which has different examination. These three nerves, that is the 3, 4 and 6 together, are examined at the same time. So let's see how we do that. So 3, 4 and 6, what do they have in common is eye movements. So all these three nerves in a way, what do you mean, they help in muscular movements because they innervate the muscles in the eyes, that is your superior oblique muscle, the lateral rectus muscle, you have superior inferior oblique muscles and all, right? So these nerves innervate them. So these nerves help in eye movements. Along with that, third nerve, it helps in the eyelid movement. So the eyelids are basically, if the third nerve is damaged, you can find ptosis in the patient. Ptosis is drooping of eyelid. So the eyelids will be drooping in one side if the wherever the lesion in the nerve is. According to that, there will be ptosis, and then it also controls the pupil size. So it controls pupil size, its symmetry. So its symmetry, whether it, like, if you take the pupil, so if it is like too small or too large, or if it is like asymmetrical, so that all depends on the third cranial nerve. And then even the pupillary reactions, how it reacts to the light, that also depends on the third cranial nerve. Now as of we take the eye movement, so there is this one simple test for examining the say cranial nerve 3, 4 and 6 is, you have to make the patient sit opposite to you, that is as an examiner, and then you have to move your finger, like you have to show your index finger or thumb finger, you will show it in a H shaped pattern, so that, like, as you can see in the first picture, the patient is looking at the left side, and then on the top, and then on the right, and then left. So these are all eye movements that is due to these cranial nerves 3, 4 and 5. So you are basically going to make the patient look up, down, left and right, and then rotate his or her eyes. So this is the eye movements, that is and this is the test that you are going to do for cranial number 3, 4 and 5. Sorry, cranial number 3, 4 and 6.